Does Gauteng government uphold the right to affordable health care? How do public and private health care disparities impact provision of quality services? How does migration into Gauteng province impact its health facilities? And why are medical equipment and facilities at some hospitals still in a bad state? What time is it? It's question time. Hello and welcome to the show. My name is Mpumalanga. The precarious situation faced by patients at the Mpumalanga province's KwaMhlanga hospital have recently made news headlines. Due to recent water supply cuts at the facility, patients have had to rely on relatives to bring them water, while others drew water from the hospital's mortuary. This is just but one of many challenges facing the country's public health system. While each province has its own unique challenges, the MEC for Gauteng Province's Department of Health, Qedani Mahlangu, says, and I quote, "We owe it to the people of Gauteng to set the bar higher, and every day we must strive to achieve our vision and take tough decisions that will ensure we provide high-quality, efficient and accessible health care to transform the lives of our people, whose only hope is the public health care sector," close quote. But how long will it take to turn these words into practice? A reminder that this is a live program, and if you've got an opinion or a question or a comment to make, you can air your views on the following numbers: 011-714-6841, 42 or 43. Our Twitter handle is @QuestionTime24. My guest today is Qedani Mahlangu, who is the MEC of Health in the province of Gauteng. MEC, welcome to the show. You presented a budget that was well received even by the opposition.
Thank you very much, and we are delighted that indeed we've seen such development in the history of our province, even from the opposition. However, that should not make us to be comfortable and not respond to the challenges that is faced by many thousands of people who come through our doors every day.
Yes. What gives you sleepless nights?
Long waiting times. People who come 7 in the morning, sometimes 5 o'clock in the morning, and they get to leave the facility after 5, or sometimes they leave the facility without having received their medication. That really keeps me and the provincial government awake every single minute of our existence.
Yes, and what are you going to do about that?
We spoke in the speech that we are going to take 40% of patients who largely constitute the bulk of our patients who are stable, who are on chronic medication, be it diabetes or be it hypertension, be it heart-related condition, spine and all of that, including stable patients who are on ARV and all of that. Those who don't need to see a doctor for 3 or 6 months, who only must get their medication supply. Those are the patients who are going to focus to take them out of our health facilities so that we allow the sicker patients to be seen quicker by the doctors and the nurses, where indeed the nurses need to see them. So that's the first point of plan, and that will see us taking more than 2 million people coming from health facilities. We're going to give them an option of collecting the medication at the nearest place of your choice, with it be the same clinic or the same hospital, or be it at a place of your choice, be the church or whatever else, and that's what we are doing, and we should be seeing this happening very soon. Also, one of the things that makes patients to wait longer is that it takes us long time to retrieve the files, because we've got archaic filing system, and that work we are addressing. We've started a Charlotte. Patient files have been screened. We're talking in total of 9 million patient files, and I'm told there's about 300 million pages in total that we're scanning, and we've scanned probably about 30% of it, and the rest of them we are going to be scanning them during this financial year up until the 31st of March next year, 2016.
Is the health service in Gauteng, and public health service, at a state where you can say, as a member of the Executive Council in charge of this department, I am happy?
I can comfortably say that we've made inroads over the past 21 years as a provincial government. First of all, I think I'd like to make the viewers understand that and remind us that where we come from. The health facilities like Charlotte Maxeke 21 years ago was only a hospital meant to serve the white community and only white community. Today it is seeing millions and millions of people, largely Africans and black, who are solely dependent on the state, who were deprived many years ago. So what the system has grown to be what it is today, it must be understood in the context where we come from. 30 years ago, the levels of burden of disease was not what it is today. HIV/AIDS was not like this. Black people were not suffering from lifestyle diseases like diabetic, hypertension, as well as and all of those. Today, 30 years ago, we've got more blacks suffering from lifestyle disease more than that. So having said all of that, I am confident that we are making inroads. We've built a good foundation, and my predecessors and the work that we're doing now, we should be able to see, we're seeing better signs. You note that we tabled in the budget speech that the national cost standards run by the National Department of Health, which is independent, has over the past 3 years rated Gauteng health facilities being the best in the country. We're sitting hovering at the lowest will be about 60% or so, and the highest sitting at about 100% being Steve Biko. So I'm confident with that work done by National Department and also our own assessment that indeed we are improving, albeit small steps, but we are wanting to make gigantic steps in the next coming few years to make sure that the citizens of our province get even better service than things are now.
Well, getting better service would be a very good thing. And I must say, I'm really happy and wish you the best. But you still have nurses and other service providers, you know, the ones which patients meet on a day-to-day basis, who are very rude, who are very arrogant. Bo, come tomorrow, I'm on lunch, it's tea time, you know?
Well, in every organization, there's ill discipline. In an organization as big as ours, 67,000 employees, being doctors who are super highly qualified, nurses, porters, cleaners, and everybody, all combined. We talk about 67,000 employees. So, and that doesn't mean that out of the 67,000, all of them are bad. And I think I must first say that we applaud the men and women who go out every single hour, every minute to save life in Gauteng, including the ambulance services, who sometimes the ambulance get pelted with stones simply because people did not get on time, simply because the service is overstretched, and sometimes, of course, there's levels of ill discipline. However, I do know that there are bad potatoes in any system, and those bad potatoes does not make the whole bag of potatoes to be bad. And we are taking this, difficult decisions as we speak. Mr. Tedu, just since April last year to date, we have fired more than 50 people in the department just for lack of discipline, with racism, insubordination, stealing patient food, taking an ambulance and go home, switch off your phone, and we don't know how to get the ambulances and all of those things. So we fired people, and this is a demonstration that we're not going to compromise service delivery directed at patients. Those who do not want to come to the party, we normally ask them to leave and leave us peacefully. And then it's important to send that message to the citizens that those who have complained to us to say nurses have tea breaks or lunch breaks together and not attend to patients. And I go to those clinics, and often I get a feedback that indeed things have changed. But sometimes people relapse, and that's why we send teams every single week. There are teams from the district offices or from the provincial office just to monitor and make sure that patients are treated like in any other organization. The customer is always right.
Forensic backlog. You came out very strongly there, and I mean, the statistics are quite shocking that in other instances people have to wait for 3 years for results of a test.
Yeah, well, part of what we must understand is that Gauteng does not only serve the Gauteng population on the forensic laboratory services. We service in Mpumalanga, Northwest, and all of that. So of course, all those provinces combined, our numbers are extremely high, and that is why we've taken a decisive action. As we speak, equipments have been bought for the histology, which is a mechanism that is going to help us to reduce the waiting times of people who are waiting for reports from the laboratory about the death of their loved one, simply from the post-mortem results and all of that, so that insurances can be resolved quickly and the estates can also be concluded and wounded up very, very quickly. The second investment we're doing, which currently takes more than in excess of 3 years, is a toxicology, which is a poison. If someone dies of poison or there's something related to poison in your system, when you go to the lab and you do those results, it takes in excess of 3 years. And again, we are also putting investment into that, simply because we know that if we do not do that, it's justice delayed and justice denied to people who are dependent on those cases and that information and reports to be given, so that matters can be concluded appropriately. And we think this investment we're doing as a provincial government is going to help our citizens and the rest of the population even better.
Okay, targeting from 3 years, you targeting what, 2 weeks, you say?
And between one month and 2 weeks, yes, okay. Yes. But that's the technology. You know that we live in a technologically advanced era, the 21st century. So it's not an excuse that why we can't embrace technology and change people's life and change the way we deliver services to our citizens.
We're taking a quick break. When we return, we'll be taking your calls. If you've got a comment or a question, the number to dial 011 714 6841 2 or 3. This is question time.
SABC News seeks to be the biggest, the most extensive and diverse news organization on the continent. Our mission is to provide accurate and credible news and current affairs programming throughout the day. We are committed to covering every part of the continent. We reflect the world to Africa and Africa to the world. SABC News, Africa's news leader. Now available throughout the continent.
Welcome back. You're still watching Question Time. Our guest today is the MEC for Health here in Gauteng, Qedani Mahlangu. And we are taking your calls on the numbers that will be on the screen right now. 011 714 64 or the 684 142 or 43. Now, MEC, lack of medicines. That's one problem. You know, the doors of health facilities can be opened. But what am I getting once they are opened?
The doors of health facilities have been open and remain open for as long as possible. The important thing which I need to emphasize first, that indeed we had challenges sometime from late last year, September, October, and they've escalated, particularly now March, April, and May this year, particularly from pharmaceutical companies who received or who were awarded tenders. And some of them had not even delivered due to number of factors, international shortage of active pharmaceutical ingredients, which is an important component that goes towards making medication and all of that. So that is one element of why there's been a shortage of medication. But from where we're sitting, you'd be aware that there was a report released at the AIDS conference in Durban recently. Yeah. Which demonstrated that Gauteng actually is managing the availability of medication much better than many provinces. The reason is because we've got what you call active, pharmaceutical therapeutic committees, which are meant to really help each and every hospital on a daily basis to understand which medication they have and which one they don't have. And those committees have been able to assist us together working with the depot. One of the problems, of course, we've experienced is that where our depot is located and where they deliver medication, they will say they are located in Auckland Park, not far from here. Qedani Baragwanath is less than 10 kilometers from here, but they say, well, we only deliver at Qedani Baragwanath on Tuesday. And for me, it doesn't make sense simply because you've got to adhere to your delivery plan, yet Qedani Baragwanath need medication on daily basis. So we're improving those kind of logistics as well. But the important message we want to say is that indeed we are working with the National Minister and all the MECs with contractors. We've started implementing penalties if a contractor has not delivered Panado and it was costing us R2 to buy it from them, and we're buying it from Qedani, who's selling us at R5. The price difference, we're going to take it from the contractor who was appointed, and that's the penalties that we're introducing. And secondly, that also we're saying to all the facilities, if you go to health facility, your medication prescribed by your doctor is not available, please ask them to give you an alternative, and you should not allow yourself to leave the facility without being given medication. If they do that, please call me or send me an email, and that is as simple as that. We'll make sure that each and every patient in our health facilities do not go home without receiving medication. On ARVs, all the fixed dose combination, we do not have difficulties with that. We've got the difficulty with the singles medication. Again, this is due to the supplier difficulty.
Eunice, welcome.
Okay, thanks, Budimpo, and your guest in the studio.
Yes.
And thanks for this time. Okay, what can I say? We see there's improvement, but I would also say on a scale of 0 to 10 in the Department of Health, I would rate the services around Gauteng province around 4. I'll tell you why. I'm a nurse in the profession, and I am cater trained, and I'm in the working age. I get appointment letters, but when you're supposed to start, you can't start, number one. Number two, daily when you go to the nursing council, there are nurses who are trained but are not registered. Nobody knows what's going on. Number three, as I'm working in Gauteng province, I've never seen intensified inspections, meaning internal conflicts remain unresolved. I have never seen inspections within these 10 years. Number four, in March, I took a patient to the hospital and they didn't know I'm a nurse, that's Steve Biko. The patient collapsed in front of me and I had to pick up and I ran to the hospital. And then I saw them giving Actrapid, that is for sugar. They decided the patient with first-level stroke, heart condition, immediate attack, and a blood sugar. How did I know it's got blood glucose that is high? On coming back, the patient said, you know what, the way I'm sweating, why can't we check the sugar? Via clicks, I bought the machine, I checked the patient, the blood glucose was 24. And that is why they gave glucose in the Actrapid in the hospital. What if I was not a nurse? And how many were turned back like that? And how many with theater trained are in the street? Like, I'm now earning a cleaner salary in the private sector. So I can assure you, I've been to all provinces, all like Joburg and Pretoria. The services, I will give them 4 because there are no inspections from the Department of Health and they cover a lot of things. They politicize facts about life.
Okay.
Thank you, Mbo.
Thank you very much, Eunice. 4 out of 10.
Well, that is the opinion, and I'm not going to sit here and pick around those issues. The point is, and I did say to you that there's a lot of improvement we can introduce, and the more you have health professionals believing in the change that we are driving, and to make sure that citizens leave their health facilities knowing what is wrong with them and be able to be given the right medication, that's the day I'll sleep peacefully, because those things continue to be a problem. Indeed, we have a lot of nurses, and I did say that there are bad potatoes in the bag, and those bad potatoes, we must all work together, because as she's saying, nurses did not do this, and as an employee of the department, she has the responsibility of going to the supervisor or to the superior of the hospital and say, indeed, I brought a patient and this is how the patient was treated and all of that. So we owe it to each and every one of our citizens to report wrong things when they are happening, instead of saying it is not my responsibility and all of that. Second, nurses are unemployed who are not registered with the Nursing Council. Indeed, Nursing Council is a regulator of all the nurses in South Africa. It's important to make sure that when nurses are trained, they are trained in the colleges which are recognized, and therefore they can, by the nursing council, and they can be given the necessary qualifications and be recognized. The third element I want to bring in, the quality of our nursing and just the quality of our treatment has gone down. Simply because people sometimes take the profession not for the love of it, and some of them said because God said I must do this. Some of them take it for wrong reasons. As a result, we have the kind of difficulties we have. And I often ask myself, and I say, I'm not a nurse, but the pain I feel for patients who are misdiagnosed, for the patients who are sent home without being treated. Sometimes I don't feel that some of our staff, and I want to underline the word, some of our staff do not feel the same pain because and this and this and that. And I say to them, the patient is always right. When they come to the facility, it's not because they are bored. They come here because they need help, and we must do everything possible to make sure that they leave here with a positive attitude.
Annalyn, you are calling us from around Gauteng.
That's right, yes, sir. My question to the Minister is, SABC Hospital, I don't know if I'm allowed to say the hospital's name.
Go ahead.
My father was submitted about 1 month back in SABC. I'm struggling for 1 month to get a complaint through. I'm making copies on behalf of somebody else of the copy, the copy of the complaint. 1 month back, when he was submitted, it was for Qedani. Then I went back and talked to a few doctors about the Qedani. On the end, he broke his hip. They attended to the hip break. And now they wanted to amputate the leg. And now they're sending him to Baragwana. But to make a long story short, sir, what are they going to do about the service in SABC? We're struggling and things are getting worse and worse.
Where's your complaint, Annalyn? Have you written it down?
I've written it down, sir.
Do you want to forward it to me, and then we'll make sure that it reaches the office of the MEC?
Pardon, can you repeat?
I'm saying, are you able to forward it, via email?
I can do that, yes, because
Okay.
I'm a very old-fashioned. I don't believe in emails and stuff, so I write it with my hand, and I went to the office of SABC,
Okay.
and I spoke even, I wanted to speak to the CEO about the complaint, because, just to give you an idea, sir.
Okay.
And one night, my father was choking. And the same night he fell and broke his bone just under the hip bone. And he's sitting with Qedani. They forced him to walk with the Qedani while he's got osteoporosis in the back. So can you just imagine for yourself? And I'm running from this manager to this manager to the matron.
Okay. No, Annalyn, what you're going to do, we'll take your contact details and make sure that your complaint is addressed as soon as possible. Please do not hang up. Our producers will take down your details. Now, MEC, I think, well, that's something that you have already referred to, that people really need to come up and speak. But let's also talk quickly about, you threatened to take away people's licenses, ambulance licenses, and they are very angry.
Well, firstly, you know that there's legislation that says no patient should not be picked up by any ambulance, whether private or public.
Yes.
So if I'm a patient, I do not have medical aid, the first ambulance that gets to the scene should be able to pick me up and take me to any facility where I will be stabilized, and thereafter you take the patient and direct them to the places where you go, where they're supposed to, if they don't have medical aid. But the practice has been that some private ambulances, they go to the patient and first of all, there's no coordination, which we are improving now. You may find that there's 3 or 4 different ambulance service providers who respond to the same problem. Netcare, Mediclinic, Gauteng government, the municipality of Joburg, depending where you are. So we're saying, first of all, we must improve that coordination. The nearest ambulance must respond to the scene so that we can utilize our resources optimally. The second problem is that we should make sure that the ambulances who do not adhere to the law, we license them. We should be able to take that license because they are not in the business of saving life, they're in the business of making money. And if indeed this ambulance is meant to make money more than saving patients, it is not worth for it to be called an emergency medical services. That's what the ambulance are about.
Okay. Jim, quickly, you are calling us from Cape Town.
Yes.
Okay.
Yes, so I wanted to say doctors and nurses generally, if I'm not talking of Gauteng, all over, I think basically they do quite a good job. But I would like to think maybe somehow they must also go under a psychological test to see if they are fit to save the people. Because some people, they look like they don't want to do the job, though they are qualified to do the job. So we will sit with the problem since we are dealing with adults whom you cannot really change their character. They bring that character from home and go to work, then the patients will get on it.
Okay.
Okay.
How are you supporting staff?
You know, just to say, we're supporting staff on a number of programs. Let me just make this one point to demonstrate how swift we act on our employees who do harm to patients. There's 2 nurses in one of our hospitals who ill-treated 2 mothers at different times, but in the same hospital, who were about to give birth, and thanks God those babies were fine and the mothers, and nothing happened to them. And they were advanced midwives. We fired them simply because of the actions they meted against the patients. What are our programs in supporting our employees? We've called the Employee Assistance Wellness Program, which is meant to assist people with psychological, whatever support they need, including also we have programs to make sure that patients, we must prevent any disease acquired from hospital by our own employees, because that's very important. Some of them are sicker now simply because they got a disease from the patients or from the hospital environment. Those things are very important. That's why the prevention, infection control is very important in each and every facility in our
I must cut you off. Unfortunately, we've run out of time. But I must say to Annalyn, please just give us a call once again so that we can get your details and that complaint. It will be addressed swiftly. The MEC is still here today. That was Question Time for today. A big thank you to my guests and to you for watching the show. Get in touch with us. Our email address questiontime@sabc.co.za. Our Twitter handle @questiontime24 from me and the crew. Have yourself a wonderful time. Goodbye.